Hello, everyone. I go by the name of YouTube Junkie on YouTube. And I figured I would do this video. I've been kicking myself and saying I'm going to do this video. I've had friends, colleagues tell me, you need to do a video. You need to do a video about women's reproductive health. Talk about your story, give your testimony, and here I am. So I want to talk about my journey and to the women and hopefully the man in your life that's listening or a significant other, that you will listen, with your heart and with your mind, and that you would grant the person that's going through their journey with reproductive issues, that you be patient with them. So I just want to share a little story. I started, perimenopause, late 30s, early 40s, typical nowadays with the weird spotting. And I would use birth control to control it. And then I would get off birth control because I didn't like it. And then I tried the birth control where you're on the pill for like 3 cycles. And then the end of that third cycle, you have kind of a 1 week or a 2 week period and you back on. And that began to give me shortness of breath. So I got off of that immediately. The shortness of breath is gone. Well, I decided to get an ablation. An ablation is where they burn off the uterine lining and to shorten your cycles, to make it little to no cycle at all. I did that and that turned out to be a disaster. So much so that I ended up getting cysts, one the size of a grapefruit and the other the size of a lemon on my ovaries. The other thing that happened, I also had the fibroids and I did the IVF. I'm not sure what you call it. I can't remember. I had that done and it didn't alleviate my symptoms. And so, of course, the doctor that did the ablation, he knew he messed up. Horrible bedside manner. He said, why don't you should just have a hysterectomy. Your body doesn't know it doesn't have a uterus. And I'm like, what? And he was just horrible. Bedside manner was horrible. I just sat there crying. I left the doctor's office, tears rolling down my face, walking down the street, just crying, people looking at me strange. For me, that was very devastating. Fortunately for me, I didn't do it. He had me to go to a referral, and that doctor told me that I need to have my ovaries removed. And I said, well, that's going to put me in menopause. He said, yeah. He said, and then we're going to have you do so many rounds of chemo. I said, well, I've been tested for cancer. I don't have cancer. Yeah, but just to be on the safe side, we're going to have you do so many rounds of chemo, six rounds of chemo. That should do it, no more than 12. And I was like, he kept looking at his watch and looking at his watch, and I can see that I was just another person. And he was waiting to, ready to go on to the next person, that 10-minute visit they give you, then they're on to the next person. And so, of course, I felt like another number. I felt like I wasn't important. And the doctor was telling me, he said, well, I'm in my 50s, by the way. He said that, well, maybe you should, he said, I mean, it's going to be over with for you soon anyway. You're not going to have any more kids. I'm like, no. He said, okay, well, then you do this. And I'm like, but I want to keep my ovaries. I don't want to get rid of my uterus. I want to grow old gracefully. So I went and sought out a different um, specialist, and that person's at the top of their field. They removed the cyst. I looked him in the eyes before the surgery. I said, please do not take my uterus. He said, well, I can't guarantee that. We are going to send a sample to the pathologist and have them look and see, if there's cancer, then it's going to be a hysterectomy. If not, and I was like, do the right thing. Don't just do this because you think it's right. Do it. I'm telling you, do not take my uterus if you don't have to, if there's no cancer. It's okay, fine. So came to after the surgery, cyst removed, no cancer. I was happy. Some months later, I had a period that lasted 6 weeks. And I was about to lose my mind, just in pain, just weak, cold, because of the loss of blood. I didn't go to the emergency room because I've done that before. They just, you know, it didn't get so bad. I know some people had blood transfusions, and I'm fortunate. I just kept taking iron to build myself up, but that constipates you. So I was praying one night and I said, you got to give me an answer. Something is not right. And I looked at a Barbara O'Neill video. It wasn't Barbara O'Neill that gave the advice, but it was someone in the comment section that gave some advice. Not to me, just to someone else that was going through the same thing I was going through. They said they were just bleeding profusely, and they were told take cayenne pepper, make it into a tea, take it 3 times a day for 4 days, or 4 times a day for 3 days. It was one or the other. I did it, but I didn't want to use the powder. I wasn't crazy about the powder. I got cayenne pepper extract. I put it in my cinnamon tea or my cinnamon apple tea, which is delicious, by the way, believe it or not. And I did that drink 4 times a day for about 3 or 4 days, and the bleeding stopped. So, where am I going with this? Ladies, before you make the decision to get a hysterectomy, I want you to listen to me and listen to me carefully. Having a hysterectomy can lead, it increases your chances of breast cancer. It increases your chances of thyroid cancer. Don't believe me? Look it up. Now, has this surgery worked for a lot of women? Yeah. But what did they have? Did they have a total hysterectomy where they take the ovaries, the cervix, everything? Or did they just have the uterus removed, but they still have their cervix and they still have their ovaries? Now, there's a difference in that too. Me personally, now I'm not a medical professional. I am not an expert. I'm giving you my opinion now. These are not facts. This is my opinion. It's not something that I wanted to do. Although the horrible stuff I just told you, bleeding for 6 weeks, and I did that twice. And the weird thing about bleeding like that for 6 weeks, it was the second time happened exactly 2 years from the first time it happened, the same month, the month of July. That was kind of weird too. I was like, wow. I mean, like my body was trying to do something, but I just knew getting a hysterectomy is not a good idea. The last specialist I had, he says a good thing you never got one, because had you gotten a hysterectomy, you'd be wearing a colostomy bag. He said that, I said, well, they said that I may have endometriosis. He said, no, you have endometriosis. I looked at your chart. I know the doctor that did the surgery. He's an awesome doctor, big ego, but an awesome doctor. I didn't care. He did right by me. He said, but he is a good doctor. And he said, he notated here that there is endometriosis. He said, what that means is that your organs, down there are like stuck together. He said, so had you got a hysterectomy, it's possible that something else would be cut. And then, like, it's laying against your colon, then you're going to have other problems. Then I talked to an aunt of mine. She was like, don't do it. She was like, I did it and I have no desire left. She's like, is that what you want? I'm like, no, that's not what I want. And I know a lot of ladies, you want to do it. You want to have your sex life back. You want to have your peace back, whatever it is. Let's try a different alternative. Change your diet. Stop eating these unhealthy oils, safflower oil, canola oil, vegetable oil. You shouldn't be eating that. That makes a difference in your cycle. Drinking coffee all the time give you some horrible cramps. Alcohol. You have to. I wouldn't just go and have a hysterectomy so I can enjoy those things, because they're gonna end up killing you sooner than later. And then also, you don't have to have meat at every meal. At one point in my life, before I had these problems I mentioned, I decided to not eat meat for whatever reason. 3, 4 months of not eating meat, my cycles were fantastic. Now, I didn't have a 3 day cycle, but I had a lengthy cycle, but I became fertile. And instead of having a 28-day cycle, which is normal, I was having a 35, 36-day cycle, which meant that I was more fertile. I had more days to become pregnant. I was actually becoming younger by changing what I ate. Imagine that just by not eating meat. Does that work for everybody? Yeah. Maybe not the eating the meat portion, but changing your diet, it does work for everybody. That is factual. That's not my opinion. If you change your diet, give it a try. You really won't know until about 3 months if it's going to make a difference on your cycles. But that's the first place I would go. Don't do birth control pills. I've tried that to try to normalize my cycle, just to, it wasn't for the purpose of not having another baby. It was just to have a normal cycle. And that's not good for you. It's dangerous for you to keep taking pills, especially past 49. Again, I'm in my 50s. So taking a pill is not a good idea because it raises the percentage of you having a stroke, a heart attack, blood pressure. It's not a good idea. Now, I do take progesterone, not progestin, but progesterone. It's supposed to be very similar, mimic what your body would normally produce. That helps me sleep. So some of you ladies that are listening to this video, you're only getting 4 hours of sleep at night. You hardly get any sleep at all. Your progesterone is gone. Estrogen is probably gone too if you're in full menopause. I'm not. I still have a cycle here and there, and I'm excited about that. Actually, I'm okay with having a cycle because that's what keeps you young. But I just don't want to have them like I was having them, and I don't. And I'm really grateful for that. I'm so glad I didn't get a hysterectomy. And I'm telling you, reconsider getting one. If you were to do it, if you have to do it, and again, I'm not giving medical advice, I'm giving my opinion. Do a partial and keep your ovaries. Meaning where they just cut the top of the uterus off. You still have the other portion of your uterus, and then you have your ovaries and you have your cervix. That's better than them taking the entire thing out. Some women, they do great with it, but most women don't. If you were to talk to some lady that's been through that, and there's a lot of young women going through it. I've met someone 25 years old. I'm sorry, she had her hysterectomy at 25. The doctors didn't even bother to see what the issue was. They just figured, let me give you a pill and cut it out. And really, you should be able to age with all your lady parts. I understand that there's situations that I did not mention that I am not intelligent enough to talk about because I don't know. But what I am saying is that before you make that decision to do that, consider the fact that you're raising your risk of breast cancer, thyroid cancer, other issues in the body. Some women have hysterectomies. The word hysterical comes from hysterectomy. They get a little crazy and mean and just a little attitude all the time. Is that what you want? Your husband doesn't want that, or your partner doesn't want that. So you may want to consider that. The other thing that I do want to recommend is that I heard a doctor call this the perfect trifecta, hopefully I said that right, is magnesium glycinate, a good probiotic. Oh crap, I'm having a menopausal moment, perimenopausal moment. What is the other one? Oh, and D3 with K2. Now, for me, to help me sleep, I take progesterone. I take D3 with K2 cream inside of my arm, back of my knees, or the bottom of my feet. I take magnesium glycinate. That helps me sleep. That helps me get at least 7 hours of sleep. Trust me, I am a much happier person with 7 hours of sleep, almost 8 hours of sleep versus 4 hours of sleep. And I work hard. So that's not going to work. I'm talking to ladies, they're pissed off all the time. I'm like, Are you in perimenopause? Like, well, what's that got to do with anything? I said, that's why you're not sleeping. Yeah, girl. If you don't want to take progesterone pills, you can take progesterone cream. You can take the cream. And I don't have one that I recommend. Just go on Amazon, read the reviews, get you a good cream or progesterone oil. Some of the creams are just as potent as the pill. Most doctors are going to tell you it's better to ingest it than to put it on top of your skin. But when I was doing a progesterone cream, it worked for me. It's just that I could not take it every day. So if you're perimenopausal or if you have horrible periods, you can take it, endometriosis. Let me be very specific. Endometriosis. You want to take the progesterone cream from day 6 to 26 in your cycle. If you're in menopause, then you have to take 5 days off. So that's kind of similar to what I said, but just 5 days off and 25 days on. But if you're doing like I do, I take the progesterone pill every day because I have more estrogen than progesterone. And I know my estrogen is starting to go down because guess what? I'm finding myself getting hot flashes. Then I'm cold. I'm like, you know what? I'm okay with dealing with that. I just don't want this period or very little period if I have one. And right now I'm having them like every 2 or 3 months. Then I may have it each month, and then I go 2 or 3 months and don't have a period. So I'm happy with that. I really am. I'm happy with that. Yeah, change your diet. Change your diet. Pray. Don't take everything the doctor says. Become your own advocate. Fight for yourself. Don't just let them take your uterus. Don't just let them give you a pill. You fight for yourself. You become your own advocate. Get in those books. Find out what supplements you need to take. From what I recall, again, magnesium, everyone needs to take that because just about everyone is deficient in it. So that's not going to hurt anything. Vitamin D3 with the K2, it has to have the K2 in it so it can direct where the vitamin D go. You don't want to have a calcium buildup in your body. When you have calcium in your body, guess what? Heart attack, stroke is coming. You may feel normal, but when that calcium builds up in the body, you don't want that. A doctor that I would recommend that talks about heart health, and you're probably like, okay, you talking about heart health. What does it have to do with my cycle? Everything. Everything, because those things are tied together. If your diet is not right and your diet affects your cycle, it also affects your heart health as well. Dr. Jamandas, Jamanadas. Hopefully I said his name right. He's on YouTube and he talks about the calcium in your body and how that shouldn't be there. All those things make a difference because guess what? Birth control pills down the road can lead to taking high blood pressure medicine. What? Yes. Taking ibuprofen because you're having these horrible cycles lead to what? High blood pressure. Briefly, I had high blood pressure, didn't know where it was coming from. And a nurse, not the doctor, but the nurse said, are you taking ibuprofen like it's M&Ms? I said, yeah. She said, that's what's making your blood pressure go up. I've always had blood pressure that's like 114 over 76. So that's pretty much perfect. Then it was like 140, 138 over 79. And that may be normal for some people, but for me, that was giving me headaches. I mean, I could feel it. I was like, this is not good. I don't know how people do it. My heart goes out to those of you that have high blood pressure and you have to manage it with pills. I will tell you something that worked for me. I don't take ibuprofen. I seldomly take it. I don't take it enough for the blood pressure to go back up. But what worked for me to get my blood pressure down, it wasn't diet, although diet is a factor. It was a pill that I found on Amazon called blood pressure support. Yeah, or max blood pressure support. And it has beetroot in it, which helps you. Another thing too, when I was not eating meat, I would have a salad every day for breakfast, or whenever I broke my fast, or I would have a fruit and vegetable smoothie that had beets in it. I didn't realize what I was doing when I was doing it. I just said, I'm going to do this and not eat meat. And then realized how much it helped me. Then I got away from it. And that's how I got into the trouble that I mentioned to everyone. So again, blood pressure support on Amazon is like 19.99. Definitely worth it. It kept me regular as far as moving. It brought my blood pressure down. I was like, wow, like a lot of people don't know about this, but that's what helped. And I know it was the beets and the vitamin C that was in it that brought my blood pressure down. So that's something else I want to recommend if you're having those issues from taking ibuprofen a lot because of the period pain. You want to focus on your D3 with K2. That's a very important supplement. It's really a hormone. D3 is a hormone. So you want to do that. Stay away from calcium. The other thing that a lot of people do, and I'm guilty of it, I've gotten better. You're not drinking enough water. You have the bad cycles that you have because you're dehydrated. You're so used to being dehydrated, you don't know that you're dehydrated, but you're dehydrated. You need to drink, if you're a 200-pound person, you need to drink 100 ounces of water. I know that's a lot. So just take half of your weight, and that's in ounces. That's what you should be drinking. And even if you're not 200 pounds, 180 pounds, 150 pounds, drink a gallon of water anyway. If you take the amount of supplements I take, I have to drink a lot of water anyway, because that's the only way it's going to work. Trauma is another reason why a lot of women have bad cycles, bad relationships, child abuse, uh, trauma. Believe it or not, that is connected to having horrible cycles. And a lot of you listening to me, if you really be honest with yourself, you probably had a dysfunctional home, or you were in an abusive relationship, um, or things have happened to you in your childhood. A lot of that ties into you having a bad cycle. I know that may not make sense, but those things play a factor in your cycle. Endometriosis is usually the result of that. So everyone that has endometriosis or have had it, um, it typically goes away once you get into menopause and get past that point, which I'm going in that direction now. I'm grateful for that. I'm grateful to the Most High for that. But you want to consider all those things. I can't say it more than enough. Be an advocate for yourself. Take the right supplementation. Drink enough water. Pray. And stop listening to people that are telling you get rid of your uterus. I hear people, I see them in the comments, oh, girl, I ain't got my cycle no more. Best decision I ever made. Then you look up, they got breast cancer. You look up, they got thyroid. They taking levothyronine or something like that. And you're saying, well, what's that got to do with hysterectomy? Everything. Because once you have that done, your chances go up. They skyrocket, they go up. So I hope something that was said that encouraged you, like and subscribe. I would be more than happy to answer your questions. In the comment section, please leave your comments. Let me know how I'm doing. I'm always humble enough to receive good critique. Let me know what else you want me to talk about. This is my first video on this, so I'm proud that I finally did it. I've been dragging my heels to do it. People have been pushing me to do it. There's so much I want to talk about. There's so many things you can do, such as oxygen therapy. Um, and it's a protocol. We can't call it a cure. We can't do that. So I'm not calling it that. It's a protocol, and it helps the risk of different cancers. It's definitely something that you want to consider. It helps with herpes. That's something that you want to consider. Oxygenation does help with those things. Vitamins, supplements. The reason why you need them is because the food that we eat, they don't have the nutrients that they had 50 years ago. I mean, basically, what we eat now is killing us. It's hard to even find healthy food, and then if you try to follow this doctor's diet and that one diet, and I'm not going to name those names, those names that's floating around on the internet. They have good information, but it's like, what can you eat? Or when you try to eat, you can't afford it. What I do want to suggest is something as simple as drinking water plenty of it every day. Have an apple every day. The supplements that I mentioned, the magnesium, a good probiotic, um, D3 with the K2, a good multivitamin. Go to Walmart, get you a good multivitamin. Eat an apple every day, as I mentioned before. If you just did those things, you would turn your health around at least by 50%. So, again, like and subscribe. Hope to hear from you. I want to read your comments, I want to answer them. Give me suggestions as well. Everyone, take care, and I hope something was said that encouraged you. Bye bye.